Well, the high cost of prescription drugs is a national problem, but it is also a Michigan problem.
The average cost of prescription drugs increased nearly 60% between 2012 and 2017, while Michiganders' incomes have increased only 11%.
Tonight, 7 Action News reporter Jennifer Ann Wilson shows us a unique option that's saving patients 50% or more on prescription drugs.
It's a bitter pill millions of Michiganders are forced to swallow.
Fiasp at $895 for a 60 to 90-day supply is crazy.
Sean Lee, type 2 diabetes. He takes Fiasp and Tresiba to live.
It can be really damaging to someone's budget.
Michelle DiMercurio has asthma and allergies. She takes Symbicort albuterol, Zyrtec, and Flonase.
I was spending $128 a month.
Because drug prices are so high, you just figure that is just the way it is and the way life has to be.
Over the past 6 years, the average price of drugs prescribed has more than doubled, according to a December report from Michigan's Prescription Drug Task Force. For example, the insulin Lantus rose from $1,792 a year to $4,703. Xarelto, prescribed to prevent blood clots, went from $2,700 to nearly $4,700. Why does medication cost so much? Well, there are a lot of layers. First, drug manufacturers set their own prices, then sell the meds to a wholesaler, which marks up the price, then sells it to a retailer, your local pharmacy. The pharmacy negotiates various sales prices with prescription benefit managers for those with insurance. The end result?
There's a retail markup, sometimes 20%, sometimes 50%, sometimes 200%.
Dr. Paul Thomas started Plum Health Direct Primary Care 4 years ago in Detroit with a mission.
We believe that healthcare should be affordable and accessible.
His unique membership-based business model eliminates the pharmacy and prescription benefit managers by getting meds directly from wholesalers.
We'll buy like a bottle of 1,000 pills of lisinopril for $10, and so it will cost our patients 1 cent per pill, or 30 cents for a month's supply of medication.
He builds relationships with manufacturers, too.
For example, insulin pens can be $100 to $300 per month, and we're able to get those for free for our patients.
Free insulin? Entrepreneur Sean Lee had been paying hundreds of dollars a month for years.
With direct primary care, I pay absolutely nothing. And I thought to myself, wow, this cannot be real.
It does seem a little too good to be true, but that's really how broken our healthcare system is.
Michelle DiMercurio joined Plum Health 4 years ago. Monthly membership fees start at $50 for adults and include doctor's visits.
So every time I wanted to renew my prescriptions, I would have to go visit the doctor. And with Plum Health, that cost is eliminated because it's included in my membership.
Sean Lee joined Plum Health 3 years ago and now offers it as a health benefit to members of his organization, the Multicultural Association of Professional Photographers.
It doesn't replace health insurance, but for maintenance of your health, people no longer have to have the fear of choosing one thing or their health.
There is legislation in the works on the state and federal level attempting to lower health care and prescription drug costs.
We have to demand transparency for our healthcare prices and demand that our hospital systems, our pharmacies demonstrate how much they bought the medications for and what they're selling them for.
Until that happens, it seems more and more people are discovering the direct primary care clinic model. There are now 12 in the state of Michigan.
There were probably only 300, 400 practices across the country when I started. Now there's probably 1,300 or 1,400 practices. So this practice model is growing exponentially.
Jennifer Ann Wilson, 7 Action News.